Dr. John Lucio. Welcome back to our channel, J&J House Call, where we discuss all things integrative medicine. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. We're so happy to be back with you again. If you have not subscribed to our channel, please do so, and always hit that notification bell right down there so you always know when our next video is up. We do about 2 videos a week. We've been gone for 3 weeks because of the
Healthy You Conference.
It went really well, all because
did.
of you guys. We couldn't believe the number of people that came and that were interested in being healthy and well.
Yeah.
Today's video is going to be focused on Dr. Lucio's lecture, which is link it in that card right up there, so you can click on that video. You guys asked so many good questions. There were so many that he didn't get to have a chance to answer. So we thought it would be a good idea to do it. A lot of them deal with CBD oil, which we'll leave near the middle to the end of the video. So make sure you stay tuned for that so you can hear your question. I'll be doing the questioning and he'll just do the answers. And our next video will be Tuesday, Wednesday, and that will deal with my talk on libido and low libido. All right, you ready?
Yep.
All right, Dr. Lucio. Oops, I lost the first question. Okay. All right, Dr. Lucio, how can I find out which foods I am sensitive to?
Now, the reason someone asked this question, because during my lecture I did mention how certain foods are inflammatory and how some people do have certain food sensitivities that make your pain worse. And there's a difference between what is referred to as a food sensitivity and a food allergy. A food sensitivity is kind of what we call IgG mediated. It's an antibody reaction. Our body mounts a kind of a defense to certain foods. It's not life-threatening, but it's extremely uncomfortable. The second one is a food allergy, and that's what we call IgE mediated. And this is actually a very dramatic response to certain foods, and it can be actually life-threatening. If you are concerned about certain food sensitivities, in other words, you get certain symptoms like bloating, muscle aches, pains, you have brain fog with certain foods, or just don't feel right after eating certain foods, there are tests that can be done with it, and your doctor should be able to do those for you. Those are called food sensitivity testing. The other way is something called the elimination diet, and that's just a technique, and it doesn't cost any money. You remove a list of foods off of your current diet, you wait a few weeks, and then start reintroducing them back into your diet and try to figure out which is the one that's causing the sensitivity reaction.
All right, next question. Dr. Lucio, is acupuncture likely to be successful with foot pain?
Yeah. It actually depends on the type of foot pain, and it also depends on the practitioner who's doing the acupuncture. Acupuncture does have very good evidence in pain management, and I recommend a lot of people to go to acupuncture providers, trained providers. So it depends on the foot problem. Obviously, if you've got a foot fracture, it's not going to help acutely. But if you have more of a chronic pain condition, acupuncture does work very well.
Dr. Luciano, what do you recommend for neuropathy?
Just so everybody knows what neuropathy is, really it's just pain caused by nerves. And we typically feel it in our hands and our feet. And usually when I get a patient coming into my clinic, they have a neuropathy, I start asking questions like, have you been tested for diabetes and thyroid disease? Those are the top 2 that we typically see that have neuropathies. There's also heavy metal poisoning, which we have to be aware of, especially in an environment that has a lot of agricultural. Also, certain vitamin deficiencies, especially B12, can be manifested in what we call painful neuropathies. So the treatment typically is, if the patient's having a lot of pain, I will start them on certain medications that have been indicated, and Lyrica is one of those that I use. Another one is called Nucynta, Nucynta. Now those are conventional medicine approaches. Once I've gotten the patient under better control, I'll start looking at some of the other vitamin deficiencies. I start getting records about their diabetes workup and their thyroid workup, and then I'll go from there and try and eventually to get folks off of the medications.
It's interesting you talk about heavy metal toxicity, because a lot of you guys work as welders and you are exposed to a lot of heavy metals.
Yeah.
Dr. Lucio, oh, this is a good one. How much vitamin D, how much magnesium, and what kind of vitamin B is in boy?
Okay. Let's start with the vitamin D level first. If someone comes in and they have a high index of suspicion that they have a low vitamin D, like they're smokers or they don't get out much, or they've got a history of low vitamin D, typically I will measure the level first and then determine what they're going to use. Now, if they tend to be on low normal, I'll start between 2,000 to 3,000 international units a day, vitamin D3, not vitamin D2. Now, if the level comes back and they're extremely low, I may even start them even higher, like 50,000 units a week for 2 months, and then put them on a maintenance dose after that. But that's typically how we approach it. But oftentimes people in Missouri, I think I've calculated one time in my practice, I had about 80% of my pain patients were low on vitamin D. Now, in terms of magnesium, I typically give it as a muscle relaxant and to help with migraines. And those are the two best uses I've had for it so far. I usually start at 500 milligrams at night. Now, if they have a severe constipation, I use magnesium citrate, and that'll help with moving their bowels. If they are not constipated, then I'll usually start magnesium glycinate, because magnesium can cause GI upset, gastrointestinal upset. In terms of vitamin B, I usually just recommend an overall good general vitamin with a B complex in it, unless they have a specific deficiency. Now, let's say somebody, though, is chronically deficient on a lot of the B vitamins. I'll even recommend IV supplementation.
I just had a joint replacement. I'm still having pain after it. What would you recommend?
Okay. Well, that's kind of a long answer to a question, or have a long answer to that question, but I'll try to keep it very short. If you look at folks that have had like knee surgeries, there's about, close to I've seen now, 20% of folks that have had complete knee replacements continue to have pain. And typically the way we treat that is with medication, nonsteroidal anti-inflammatories. If that doesn't help, then what we call membrane nerve stabilizers, like Neurontin and so on. And if those don't work, then we actually can go in and block those nerves and then do what is called a radiofrequency ablation, where we actually burn the nerve. Typically, we want to make sure the patients always had enough time to heal before we doing a lot of those things, because eventually those do get better. We do occasionally see patients that have had hip pain. I just recently did actually a radiofrequency ablation where I burned the nerves in a patient's hip who had complete hip replacement, and there was no other reason for them to continue to have pain, and the implant was okay. Which, by the way, if you do have any kind of joint replacement, you continue to have pain, you really should go back to see an orthopedic surgeon just to make sure everything is okay, the implant is in good position, there's no infection, those kind of things. I've seen even cases where patients have had shoulder replacements and shoulder surgeries that continue to have pain, and you really have to just be very detailed about how you look at what's causing the problem. It could be a joint, shoulder joint isn't as simple as people think it is. You could replace a joint, but you can still have other types of strains and other impingement syndromes that can occur. So you've just got to make sure you have the right diagnosis and make sure there's no surgical correction that needs to be done again to help the pain. Now, if those don't work again, as I mentioned before, we'll try medication. There's certain nerve blocks we can do that will help with that as well.
Are there any type of anti-inflammatory, is there any type of anti-inflammatory that does not affect the kidneys?
If you're talking about prescription strength anti-inflammatories like what we refer to as Celebrex, ibuprofen, Aleve, diclofenac, all of those are just that are on the market now. All of them affect the kidney. Now, there are some anti-inflammatory botanical and supplements that we use oftentimes. Bromelain is one. Fish oil is another. Some people believe in chondroitin and glucosamine. Others turmeric and ginger. And so there are some alternatives. Those will not affect your kidney.
Here we go to the CBD questions. Is CBD oil useful to Alzheimer's patients?
I've never seen any study that CBD oil reverses or aids or alleviates the symptoms of Alzheimer's.
Does CBD oil interfere with other medications, and is it safe for people to use with autoimmune disease?
It's safe to use with autoimmune disease. It can cause some sedation in some people, and in fact, some people use it to help them sleep. So if you're taking like sedatives or anti-anxiety medications, you have to be a little careful because it can make it even more potent than what it was. And so those are the main interactions.
This person is taking 2 depression pills a day plus trazodone at night. What are the effects if you take CBD oil with these?
It can make you more sleepy.
At what dose would CBD oil make a person test positive on a drug screen?
If it's a source of CBD oil that's mostly CBD oil, you're unlikely to test positive for THC. There are some preparations, though, that have a very small amount of THC, and you don't know how it's going to be metabolized, so it can be even a small amount, even a greater amount, depending on the source of the CBD that you take. So it really depends on where you get it and what it has in it.
CBD recommended dose to take on a regular basis, and how long until results are typically seen?
If you're going to take CBD oil for pain, now the dosage for pain is 2.5 to 50 milligrams per kilogram of body weight. So an average person for pain would be taking anywhere from over 200 milligrams a day up to 3,000 milligrams a day to help with pain. However, I do notice that patients take even smaller doses do get some improvement with it, and it does help with their sleep. So even smaller doses can help with their sleep. You do have to take it for a few weeks to actually see the effects. The studies that I've read, will not get it in the first 2 or 3 days. If you've already bought the bottle and you're using it, give it a fair shake to see if it's going to work or not.
Well, do you believe the benefits of cannabis use outweigh any potential problems with lung issues, etc.?
Okay. I do not recommend using cannabis in the smoke form. I prefer that they try edible or even tinctures, because why introduce smoke into the lungs? That's just my personal preference.
Is there a particular vitamin B that helps for neuropathy? And the second is cannabis for neuropathy.
B6 is the vitamin that we typically focus on whenever we have someone with a neuropathy, and we start looking at that as well. But I also check B12 as well, because they will also have deficiencies in both.
Oh, that's interesting.
And what was the second part?
Cannabis for neuropathy.
Okay.
They were wondering if that's
If you
helpful.
look at the studies with cannabis, the best results have been with people that have had chemotherapy-induced neuropathies. And that seems to be the strongest evidence right now, so it does help with those.
The last question is, can you tell us more about consumerlabs.com?
Okay, actually it's an organization that we can subscribe to that will actually give us the quality of different botanicals that we use and supplements that are out there.
Maybe we can only subscribe, or can they
Oh,
subscribe?
you can subscribe to it. We get it and we refer to it, at least I refer to it about once a week. And we can look at forms of CBD oil, forms of different botanicals that we use, and it gives us the quality and how much content is in each of those.
That's it. Those are really good questions. And what's next?
Well, next time Dr. Sue is going to be fielding questions that we had from the audience about libido and women's health. And this is going to be a great session, so please try to view it on the next time it comes around. Thank you.
See you again in our next video.
All right, bye-bye.